Healthcare Goes Viral, educating patients in the digital age.
Thank you very much for having us, and thank you to my esteemed panelists for joining me on stage. So I am going to talk to you a little bit about YouTube Health, and I will get all of our wonderful panelists to introduce themselves, and we'll get into a few questions. So my name is Vishal. I'm a clinician by background, working on the YouTube Health initiative for the last 4 years. So we are making it easier for viewers to access authoritative health information on YouTube. So if you search for any health topic on YouTube, at the top of the search results, you'll see a shelf labeled From Health Sources. So that contains videos specifically coming from authoritative sources, from NHS organizations, from health charities, from individual clinicians like Asma, Tasnim, and Veena. And so we have been forming very close partnerships with all of those organizations and individuals, encouraging them to create more and more content, addressing gaps that we have in our various different topic areas. So that's a little bit about YouTube. YouTube Health, sorry. I am now going to pass over to our panelists to do a brief introduction about themselves and what they're working on in this space. So, Asmine, I'll start with yourself.
Hi. Great to be here and speak with you guys. I'm Asmine. I go by Dr. Asmine on social media. In the 3 or 4 years I've been creating content, I've reached about 400,000 followers. Started off in COVID when I realized the amount of misinformation on social media, and I realized we need to do something. And it's been such a pleasure to be part of this community and have so many opportunities thanks to YouTube Health, collaborating with the WHO, with the UK government. And now that's led me on to starting health media consultancy with the aim of helping NHS trusts, pharmaceutical companies, and MedTech companies to improve their communications and social media strategy, as well as our public-facing podcast called The Pop-Up Docs, to talk to real people about their lived health experiences, including celebrities and politicians. So really, really passionate about using the social media platform to make a lasting impact and difference when it comes to public health policy and patient outcomes.
Hi, Hi, my name's Dr. Veena, and that's what I am on all the online platforms as well. I'm a full-time GP, broadcaster, and clinician creator from London. I started my YouTube journey initially with dance and then pivoted into health and health education when I qualified as a GP. I also run a charity specifically focused on South Asians with diabetes. And recently, through all the social media, health promotion, advocacy work, I've been able to work with some MPs, work with policy, health think tanks, and also collaborate with 10 Downing Street for charities like WaterAid. So the opportunities and the impact we've been able to have because of platforms like YouTube Health has actually been something that I myself couldn't have fathomed. And I'm really passionate about health equity and health promotion on a global scale. So I hope in the coming time I can impact that as well. Thank you.
Hi, I'm Tasnim. I'm a doctor, entrepreneur, and health educator. My focus is to improve access to evidence-based health information in underserved communities and fight medical misinformation. I do that through my YouTube Health channel, other social media platforms, and my health tech company called Shohai Health.
Fantastic. Thank you very much, everyone. So I am going to ask our panelists a few questions, but I will then throw it over to you guys. So have a think if you have any questions for our panelists, and then we can come to those. So I want to start by asking, what motivated you in the first place to get started creating health content online, on YouTube and various other places? And I guess what motivates you to continue doing that? It's hard work. For any of you who've already got a YouTube channel out there, or you're thinking of starting one, you know, it doesn't happen overnight. It takes a while to develop a following, and takes a lot of sort of thinking about what are the right topics to focus on, etc. And you really need to have a strong why for getting started. So yeah, just wondered if you guys could share your motivations for this work.
Sure. So I'll start. I always wanted to start a YouTube channel. In fact, I started one in like 2010 to post Minecraft gaming videos, and I regret not following that further because I'd have been a multi-millionaire by now. But I realized by the end of medical school that I with the misinformation during COVID and my creative passions, my graphic design, my technical knowledge, all of that with my USP of being a doctor meant that I had the ability and the passion to start creating health content. And the first 2 years or so hardly saw any returns, but I keep thinking to myself, it's just one person that needs to be impacted by a video for it to actually have done its job. And now my videos reach millions of people, some of whom are healthcare students who have been inspired to become doctors, some of whom are patients who've been inspired to get vaccinated or been informed about a particular important health condition. And just seeing that kind of reception is such incredible motivation for me to keep on going, despite the difficulties. And I think the difficulties are mitigated by having a process in creating the content. But alongside that, I think it's so important to have your why. And the response I've received from my comments is just motivation for me to keep on going.
I think for me as well, it was initially a platform to exercise your creative muscle. And when you're in a very high, strenuous academic job, you don't have much room for that. I don't know if you guys agree.
Yeah.
And then having a creative outlet is what initially was the passion. And then once you build a community that trusts you, trusts what you have to say, you realize what you say has weight and what you say has more power and responsibility. And then you can change that and really impact people with the work you do. So I think that's my why. Seeing people face to face and them telling you their stories of, actually, because you said that, I did this, or because I saw you do that, I know I can do this. Because when I started, there was no points of reference for me. I didn't know anyone else who was a dancer, was a doctor. I didn't know if it was even possible. Yeah. And now I have a whole generation below me who are like, we do this too, and this is how we started, and that's amazing to see. Yeah.
So my journey in health content creation started during COVID, like as mine. So at that time, I was working as an A&E doctor at NHS, which is a public healthcare provider in the UK. At that time, we were seeing very unwell patients. So I was witnessing firsthand what COVID does to a family. But then when I would come home and scroll through social media like we do, I was seeing stories where people were claiming COVID's not real, it's just another flu, or videos which were promoting dangerous practices as definitive cure for COVID. So those really troubled me. And then there was a report from Public Health England very early on in the pandemic, which showed that the highest risk of death from COVID was from people with Bangladeshi ethnicity. And the risk of death was nearly twice compared to people with white British ethnicity. So these deeply troubled me. And then I thought I would make some videos to make people aware of how they can protect themselves from COVID. And I had really 3 key principles in mind: that my videos will be brief, it will only contain information that people need to protect themselves from COVID, and they would be evidence-based so that people don't need to waste any time, money, or effort in doing things that don't work. And the last thing was my videos would be in easy to understand language. It's everyday language that people use so they can understand what I'm talking about, they can remember what's being said, and they can implement it in their daily lives. So those 3 principles I still follow when I create videos. And in terms of why I'm still going, I think it's because people appreciated that so much, and standing here now, I wouldn't believe that people would actually consume these straightforward health information videos online. So I'll just quickly share a story which Vishal and Azman already know in terms of impact. So as I was flying to Malta, I was flying from Dhaka. I took an Uber to come to the airport, and as I stepped, I was getting into the car, the Uber driver came out and he greeted me with my name, saying, "Hi, how are you, Jarapu?" So that's like a colloquial Bangla word saying, like an affectionate term. So that sort of took me aback because he was quite warm, and it was as if he knew me from before. So then I got into the Uber, and then he shared a story with me that moved me deeply. So this person's name was Abu Saleh, and he told me that he used to be a smoker, but then he watched one of my videos on how and why to quit smoking, and then he stopped. He stopped smoking since then, not a single puff, and now he can't even stand the smell of cigarette smoke. He was sharing this with me, and he was saying that he's since then sent these videos to his other friends to help them quit smoking. And this was so moving, because we need more people like this who look after their health and are also acting as agents of change in their community to try and promote good health. And it's stories like this that really tell me how simple messages can have such a big impact. And that's my why. That's why I keep going and make this content.
Amazing, Tasnim. What a wonderful story, and just shows you the type of impact that you can have all over the world with this content. But that is why we do, all of us on the stage here, do what we do with kind of the health content, because I think entertainment content, sports, comedy, it's all fantastic. Gaming content, it's great. You know, I think that everybody needs to have their downtime. But the health content that is out there online really is often a matter of life or death. And it significantly impacts and influences the health and well-being of so many people. So it really matters. And actually, there was a colleague of mine who put a paper out in Nature earlier this year around information as a determinant of health. So I guess if we look at Tasneem's example, where if you share the right information with someone, it can make a meaningful difference to their health behaviors, and actually more so than often any medication or treatment, that information can have a really big difference. And actually that information is then embedded in a community, and it's passed down multiple generations. So it has a long-lasting effect as well, the information. If we can share the right information in the right way, targeted to different communities. So I wanted to kind of continue that theme from Tasnim and ask Veena and Asmine if you've got any kind of examples where maybe you've used your videos in clinical practice, or where you've heard from patients anecdotally, or you've seen via your comments some of the impact that your content is having. If there's anything that either of you wanted to share in that regard at all.
Yeah, absolutely. Tasnim, that was an amazing story. And I think that is the reason why you do what you do, right? So being a GP and, you know, treating so many patients from like the NHS private sector, one thing I've learned is the person sitting in front of you wants to feel heard. If they feel heard, they will trust you. If they trust you, the motivation doesn't become extrinsic motivation, it's intrinsic motivation that will drive change. That's going to make them want to take active steps to health. Because I think behavior change is at the basis of a lot of chronic disease. And that's what my biggest struggle in primary care as a clinician. So coming back to the videos, there was this one video I had made about PSA testing and the pros and cons, the sensitivity, how it's called prostate-specific antigen, but actually it's a very non-specific test. And I was, again, outside my practice having a coffee with a staff member, and this gentleman comes and he goes, "Yo, doc, I saw your prostate video." In the middle of the street, and I was like, no, like, I don't have a prostate, it's not my video. And it was all like taken out of context, but he was like, no, I watched that, and I showed my boys, because they came from a group where prostate cancer ran in the family. They were men in their late 30s, 40s, and they all just thought doing this blood test is what they needed, and that video helped him understand it's not that specific, the pros and cons, what they need to do beforehand. And although that information is available online in different forms, he was like, watching that made me really understand, just because something is said to do something, it doesn't mean it's always going to have effect or what the actual outcome needs to be. So that was quite nice, in just a humorous form. And now it's come to a point where at the practice, they actually send some of my videos as attachment to patients, whether it's about mental health or the things you can do at home. And again, it comes back to trust. When you have someone you see day to day doing the job, talking about their experiences, that trust factor is there, and that again embeds back into intrinsic motivation, which I think if you can inspire your patients to do, is half the job done. Yeah.
So for me, my content is focused towards both healthcare students and professionals as well as the general public. So impact-wise, within the realms of social media, we talk about so-called vanity metrics, the number of followers, the number of views, and that is a measure of impact. And it's obviously great when loads and loads of people see our videos, because we want our videos to be seen. We want more people to be informed by them. But I'm very adamant on stressing that impact is so much more than that. When someone leaves a comment to say that, you know, thank you for raising awareness about my rare condition, like, I've not been taken seriously by other healthcare professionals before, and I'm really glad that you're raising awareness about it. Or when I get comments from students all across the world being like, thank you for helping me pass my medical exams or inspiring me to become a doctor, that kind of message holds a lot of weight, personally. That's the kind of stuff that keeps you going, that you wake up in the morning for. You know, when the day job is very difficult, like it's difficult to wake up every morning, go to the hospital, and I know a lot of you are healthcare professionals, so this is just a way of reaching out to so many people beyond the four walls of the clinic and realize that your potential and impact is so much more. And it's at that point that you become something greater than yourselves, because it's all about that mission of actually helping improve humanity. I'm talking, you know, it's all very lofty, but I think that's genuinely the level of impact that we can have as clinicians on social media. And testament to that fact is, I said I have 400,000. Veena has close to 1 million followers. Tasneem has 10 million. Vanity metrics, maybe, but that's how many people they've helped at a minimum, because just visualizing that number of people having been impacted by those health videos, and like the story Tasneem says, it's beyond our imagination how much we can actually help people, and that's the level of impact.
Guys, thank you so much. I hope the audience is now suitably inspired to get started creating content on YouTube. So I wonder if we could share some tips with the audience in case they want to take those away and start their own channel, or in case they've got organizations they're working with or for who maybe have got a channel or would like to start up a channel. So I wonder if we could hear from you guys about your kind of top tips, or what do you wish you'd known about creating content online, health videos specifically, video content that you know now, or you know, what is your process for creating content? You know, whatever you think might be helpful for those who are in the earlier stages of their journey around health video content creation. So maybe if we start with Tasneem and then move this way.
I think for people who would want to start creating content, it's important to focus on things that you enjoy. So there are lots of areas where we can create content on. Starting with something that I enjoy and I'm passionate about, to let other people know, to teach other people, that's probably a good start compared to, you know, there are some areas of content creation where we know that these are popular. Not necessarily that would be the right fit for me. So if we start with something that we are passionate about and something that you enjoy, that would be a good way to start. And the other thing, even better, if that is something that gives value to people. If it's something you enjoy and if it's something of value to people, it's bound to add so much meaning to your life and the people that consume your content as well. I think that those are my top tips. And technicalities, I think Veena and Azmine will be.
Yeah, no, I echo that. I think know yourself. Are you trying to entertain, educate, motivate, inspire? What are you trying to do? And know your audience. Are they students? Are they clinicians? Are they your peers? Or is it the general public? If you know these two kind of sectors, you know what you're trying to create. And if you're doing health content, make sure it's evidence-based. Make sure you have some kind of a script and you date it, time it for when you released it, because research changes, data changes. Make sure you're not kind of breaking any laws or rules with the GMC or the code of conduct of, you know, your health body. And have fun with it. I think having fun is key, because it does become a job. It is work. You need to be motivated to do it. and start when you want to start. Don't start when you're ready. That's the only thing I'd say, because everyone thinks you want to wait till you're ready. You're never going to be ready. Just start.
Some amazing points. I'm going to reiterate some of them, because I always say the 3 key tenets of any kind of piece of content, whether that's a documentary or a movie or indeed a YouTube video, is education, entertainment, and inspiration. If it fits one of those 3 key tenets, then it deserves to exist. If it fits 2, then it's a great piece of content. If it fits all 3, then it may well be destined to go viral on social media. So I have a very keen passion on training up healthcare professionals as well as industry professionals in the step-by-step process of doing this. So feel free to get in contact. But in terms of the outlined process, it's generally idea, make sure you have a solid idea and gain inspiration from the news or from your circles around what you want to create an idea about. Script, for us, is very important to have a solid evidence-based script. Then you do the filming and editing process, and there's, those are the technical aspects which we've gained a lot of experience in, so you can ask any of us about how we've approached that. And then thereafter is uploading the video and seeing the analytics of how it's done, responding to people's comments, responding to how you can make better videos in the future. And that's the basics of it. There is, as medicine, content creation is both an art and a science. So you get better with practice, but I reiterate my esteemed colleagues that you're never going to be ready, so just get started and go forth with the intention of putting out great content and having a positive impact on the world.
Brilliant. Thank you very much, guys. So I'm going to open up to any audience questions, if we have them. We've got a few minutes left. So if anyone does have a question, then please put your hand up, and I think we can get a mic to you. But in the absence of any questions, yeah, okay, fine, we've got one question. So Tosin in the front.
Hi, thank you all so much. You all spoke about, what a great impact social media and YouTube can have. But have there been any difficult moments or any barriers that you've had to overcome in your journey?
Maybe if I ask one of you guys to take that, so we get a few more questions. There's someone, I guess, resistance from the healthcare profession, maybe from fellow colleagues. Have any of you guys faced that specifically?
Yes, there are some people who will give some resistance because they don't see the value in it, or they don't realize that it's essentially the future. And we're very keen on showing the value that we've already had and the impact on patients throughout our journeys on social media. And, there is so much misinformation and bad acts on social media. If you can't beat them, join them. And we have already proven the fact that these videos have a tremendous impact. So I genuinely think that if you show the results of your efforts and are sincere in the reasoning behind the content creation, which is to positively impact patient health, I think that's the way to get the naysayers on board.
Brilliant. Thank you, Asmai. I'm going to close. Okay, we've got one more question here, and then we'll just do closing comments. So go for it.
So one of my biggest problems is my consultants, august consultants, want to be factually correct with any social media to the extent it is so dry and so unapproachable for the common person. And I have the most god-awful time trying to explain to them it needs to be far more relevant to a patient rather than an academic paper they want to shove down someone's throat. What's your advice for my consultants?
Should we get Tasneem or Veena? Tasneem, you in the hospital environment, aren't you, at the moment? So.
I think it is difficult. It is a challenge because in our medical world, we almost speak a different language that patients do not necessarily understand. So it is definitely a challenge. But if you can show them some examples where they have done very good patient communication, request them to come to the shoes of the patient and what are the questions that the patient has, rather than, us coming from the point of epidemiology and risk factors. It's trying to think, what are the questions the patients have? And sometimes they need a bit more guidance, sort of. So if you can show them example videos and the questions that patients have, and if they can speak directly to them, I think those would be helpful. And I would just add to what Azmine said earlier in response to Tosa's question about the challenges we face. I think sometimes it does get quite difficult, especially when you're creating content online. There are bullies and harassment that goes on, especially from people who don't want you to speak. So when I was advocating for vaccines for COVID, I was called names, I was called a mass murderer, and a lot of things. But in those moments, what helped me keep going is, these people don't care who I am. They just want my message to stop. So if we can think about what's the purpose, why am I doing this, and what's the message that I want to get out, then it becomes easy to get past those. And also having a community which is really supportive during those difficult times also help.
Thank you so much, guys. We'll just do very quick closing comments. If we can have a sentence from each of you guys about what you're planning next year or how to look you guys up, whatever one thing you want to say, if we stick to one sentence. So for me, I would just say, if you want to learn more about YouTube Health, go to health.youtube. On our website, there's lots of different information about the initiative, about applying for the health shelves that I described, some videos with best practices for creating health content, and updates about future events as well. So that's mine.
So I want to build my YouTube channel to 1 million subscribers, and I'm very keen on building the Pop-Up Docs podcast health media consultancy, and I'm very keen on helping you guys to improve your communications and strategy from that perspective. Search Health Media Consultancy online, sign up to our newsletter, and connect with me on LinkedIn, and can't wait to speak with you further.
You can find me at Dr. Veena on LinkedIn or any of the platforms. I'll be focusing on policy work and, again, building the health equity side of things. One thing I want to leave everyone with is, if you are a clinician and you have a platform, you definitely you underestimate the power you have in your hands. So I would encourage you to use that platform to spread health awareness.
For me, I think I want to spend more time with the communities that watch my videos. So my social media platforms have now grown to about 12 million subscribers, and we've had over 1 billion minutes of watch time. But I'm based in Cambridge. I do these videos from my home in Cambridge, but these are being watched by people in Adawarpur in India, from Ponchagore in Bangladesh, in Malaysia, the migrant workers. So my plan for 2025 is to visit these communities and understand their lifestyle, their habits, so that my videos are more useful to them. So that's my plan. I've started in 2024, and I plan to carry it in a broader scale in 2025. And very happy to connect with clinician creators or just health content creators to share my insights and help in any way I can. I'm available on LinkedIn with Dr. Tasneem Jara. Thank you.
Thank you very much.
Thank you.